Standing position. Here we categorize the standing position into the lateral view, the anterior view, and the posterior view. The posture is easier to describe in a static standing position because, except for a slight amount of sway when standing, the body is not moving. However, many of the guidelines for static posture can be applied to dynamic posture. Assessing a person posture can be done most accurately with the use of the plumb line suspended from ceiling or a posture grid behind the person as a point of reference. A plumb line is a string or cord with a weight attached to the lower end. Because the string is weighted, it make perfectly straight vertical line of gravity. Lateral view. In the standing position and viewed from the lateral position, the plumb line should be aligned so that it passes slightly in front of the lateral malleus, as we can see in figure. For ideal posture, the body segment should be aligned so that the plumb line passes through the landmark as listed in figure as follows. Head. It passes through the ear lobe. At shoulder. It passes through tips of the acromion process. Thoracic spine. It passes anterior to the vertebral bodies. Lumbar spine. It passes through the vertebral bodies. Pelvis. It passes with level with an anterior or posterior tilt. Hip. Through the greater trochanter, slightly posterior to the hip joint axis. At knee. Slightly posterior to the patella. That is slightly anterior to the knee joint axis with the knee in extension. Ankle slightly anterior to the lateral malleus with ankle taught in a natural position between the dorsiflexion and the plantar flexion. Next, at anterior view. In the standing position and viewed from the anterior position, the plumb line should be aligned to pass through the mid sagittal plane of the body. Thus, it's divided the body into two equal halves as we see in the figure. The following body segment listed should be aligned as follows. Head, it passes from extended and level, not flex or hyperextended. Shoulder at level and not elevated or depressed. Sternum centered in the midline. Hips level with both anterior superior iliac spine in the same plane. Legs slightly apart. Knees level and not bowed or knock knee. Ankles normal arc in feet. Feet slight outward toeing. Next, from the posterior view. In the standing position and viewed from the posterior position, the plumb line should also be aligned to pass through the mid sagittal plane of the body that divides the body into the two equal halves as we can see in the figure. The following body segment listed should be aligned as follow. Head, it extended, not flexed or hyperextended. Shoulders, level and not elevated or depressed. Spinous process, centered in the midline. Hips, level with both posterior superior iliac spine in the same plane. Legs, slightly apart. Knees, level and not bowed or knock knee. Ankles, calcaneus should be straight.